All right. Hey guys. So today we are doing the last part for Thorax MCQs. Up. And today I got a link will from the viewers so that everyone can join. Just give me 2 minutes. Hey, I'm fine. Hey Zubair, I'm fine. Glad to see you that you're already here. Just give me 2 minutes before I start. Allow me to go to the washroom. Give me 2 minutes. Really sorry. Okay. Hi Raju Pavan Sadwani. How are you? Let's begin the class now. What's the topic that we are doing today? The topic that we are doing today is going to be MCQ Marathon Part 3 for Thorax. This is the final part of the MCQ Marathon. So let's start. Welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, their NEET PG division, right? So where you are getting all your MBBS related academic videos, where top educators are preparing quality content related to your entire MBBS course. Okay, and this is also useful for I would say nursing or BDS graduates or people who are pursuing that course because some aspects of the syllabus are similar. So if there is some place where you find an overlap, you can attempt this, right? Okay. Good evening, Dr. Samir. Okay. Hope you're fine too, Zubair. Hello, guys. So, and you're obviously assured a great learning experience. So, we'll try to keep our class as interactive as possible so that we guys can benefit from each other. We know about the important things in the entire thorax, and when we do that, we also enjoy it, right? That's going to be our goal for today's class. So, first of all, if you're wondering who I am, my name is Chetanya Mittal. I am a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi, India's best medical college, right? UG entrance examination rank in the AIMS examination was All India rank 4 and All India rank 5 in the JIPMER UG entrance examination. All these examinations have been now merged to a single examination called the NEET examination. Similarly, for PG, you know that all the examinations are going to be merged as a single test known as the next examination. It is not just going to be your PG entrance, it is also going to be a mandatory exit exam. What does that mean? That you will only get your MBBS degree if you have cleared the next examination. So it's very important for you to be doing this. Okay. It'll be in two parts, next one and next two. Next one is supposed to be theory, next two is supposed to be a practical exam, although बहुत ज़्यादा details नहीं आई हैं. Next one will have 10% weightage of pre and paraclinical subjects. ठीक है. So that's the latest pattern of the examination. Recently, INICET examination was conducted, right? And Unacademy will very soon discuss the question paper with you for various subjects. And let's hope we're part of the discussion. So let's move ahead to thorax. Let's move ahead to thorax. So, like I said, thorax MCQ marathon. So all my MCQ sessions, they're called as MCQ marathon part, right? So I usually do them in 3 parts for every topic. So why are they called marathons? Because they're long sessions where we discuss each and every concept that comes in every question, and we try to do around 150 MCQs for each. For thorax, we are having a little less. We are having 145. Okay, so today our target is question number 101 to question number 145. So that's how long the lecture is going to be. You can estimate based on the number of questions. Okay. Also, there is this playlist called MCQ Marathon on Let's Crack NEET PG, the YouTube channel. This playlist में all the MCQ sessions they are there. You can watch through these sessions, watch them on 2x, skip through the pauses, right? So this is about my plus course, a little bit about my plus course, and this plus course it starts tomorrow, right? It starts tomorrow at 22nd November 2020. First class is on 10 p.m. tomorrow, right? Tomorrow 10 p.m. is the first class of our plus course. Okay. So the plus course is on gastrointestinal physiology, as you can see, and we're going to be covering everything right from the start till the end. Okay. And we're also going to do MCQs in this course also. But my main focus will be on imparting the theory to you in a very structured manner, right? So I have prepared a course schedule for you all for this course. You guys can have a look at the course schedule. And if you guys are preparing for your profs and if your profs are in January, so I would recommend that on December 1, take a plus subscription. Take a plus subscription so that December 1 and take it for 1 month. Okay, take a 1 month plus subscription, December 1 to December 31st, right? In that period, If you use Unacademy Plus, you will be able to access this course, okay, and you will be able to learn about GI physiology. I will probably make one more plus course in January, sorry, in December. You can see that also. Then other educators, they have also made plus courses, and some of them might have made on different topics. So you will get coverage for entire first prof. You will get coverage for entire first prof that way. So, and if you take this plus subscription, do use my referral code, that is Chetanya10. If you use this referral code, I'll tell you what are the benefits that you get. The first thing that you have to do, this YouTube session is obviously a free session brought to you by Unacademy, but this is just the tip of the iceberg, right? There is so much more content. The problem with YouTube is that अभी आपको नीचे recommendations आ रही होंगी of your videos that might be, depending on what kind of videos you watch, might be entertaining videos. But when you, so they might distract you. You might find some video attractive, you will click on it and you will go there. Plus you are shown ads here. Okay. So what you have to do is, a better way to learn is to go to the Play Store. Go to the Play Store and search there in the Play Store. I think everyone can do that. Search Unacademy, right? The first result would be this Unacademy learning app, right? And you can simply go ahead. This will be a free app. Just go ahead, download it, install it. It's free of cost. And as you can see, it's about 3 lakh people have already given reviews. It's 4.6 stars. Okay. App size भी ज़्यादा बड़ा नहीं है. iOS में obviously it will be a little larger, but that's okay. Over 10 million downloads already, right? So what are the benefits of downloading the app? So I'll come to the first benefit, that is, first of all, there are so many top educators who are taking classes exclusively on Unacademy, right? And all of these educators, you can see some of them, they are also from my college, that is AIMS, right? And there are so many people who are teaching here on Unacademy. Okay, so then you have, they have decent number of watch minutes, decent number of followers, people who regularly watch their videos, right? So you will know about all this. And see, there are a lot of top educators here. So on Unacademy Plus, people like me, they are creating plus courses. So you can see, for example, if you want to learn about what is the strategy to go around for general medicine, so there is a strategy course on general medicine which you can watch by Rajesh sir, and this will give you an entire idea of how to go about medicine. Similarly, there are batch courses. What do you mean by batch courses? So this is a batch course for NEET PG central nervous system. So here you will have the anatomy of central nervous system. You will have the pharmacology aspect related to central nervous system. Okay, you will have the physiology of the central nervous system. So everything will be covered in a batch course, right? So that is how these courses proceed, and that is the system of Unacademy Plus. All of this is accessible on the app. Okay. Besides that, now you will say that what if I don't want to take a plus subscription? You should still download the app, because see, like this class is a free class. Similarly, you have a lot of free special classes on Unacademy. You have free special classes on Unacademy for NEET PG. So example is that I have made a special class on coronary circulation. That's a free special class. You can attend that. You will be able to learn everything that you need to know about the coronary circulation. Okay, that's the first thing. Second, for example, if you want to learn about basal ganglia, so I have made a free special class for that. Okay, so I have made free special classes for all relevant topics. I am continuously making more, so you guys can keep seeing them as they come. Right? You can watch them as a live class. You can watch them later. Then advantage of downloading is that you can attempt free mock tests for your NEET PG entrance, which will be very useful when you are in the preparatory phase. And if you have a plus subscription, trust me, you will never fall short of questions. Every week, a complete mock test is uploaded. Okay. Now see, why is Unacademy a good place? Because the next examination, according to the next examination, everything has to be updated for the next examination, right? Part A is preclinical subjects, Part B is paraclinical subjects, and Part C is clinical subjects. You can see Unacademy has made more courses for clinical subjects because clinical is going to have more weightage for your next examination. Yeah, there are also multiple courses for Part A and Part B. There will be no shortage of information, but we are having stress on clinicals, right? Even you will see in my classes, I try to stress upon the clinical anatomy. I have made a special class that I would say is a must watch, A to Z clinical anatomy of the breast. Okay, I've covered 26 clinical anatomy points. Go ahead, download the app, watch this class, and see, you all are having busy schedules. तो अभी आपने क्या पता तब ये क्लास अटेंड ना करी हो, but now that I've told you about it, you have the option to enroll yourself with a flexible schedule. ठीक है, you can watch a class at your own convenience. You have the option of learning in whatever language you want. Right now I am speaking in English, I can also speak in Hindi. Okay, so that does not matter. And then there are educators, trust me, who are teaching in Tamil also, right? Then unlimited practice, you can retake the quizzes, you can watch the recorded sessions as many times as you want. So everything is unlimited when it comes to Unacademy. Your learning should never stop. Then it will feel like you are right in the classroom. Why is that? Because you have the option to chat with the educator. Unacademy, the platform, has a very robust chat feature where it's much better than this YouTube chat. Okay, but although I'm still reading this entire chat, so you can ask your doubts freely. Then interactive polls. Unacademy में तो सीधा एक KVC की तरह पोल हो जाता है, ठीक है? यहाँ पे क्या है? I will show you the question. You write the answer. You write the question number. Alright, so let's say I've shown you question number 110. You write 110 and you write the answer here, right? 110 का A, for example, ठीक है? Then convenience तो है ही. Learn wherever you want, learn anytime you want, ठीक है? Now there are two kinds of courses. There is the plus course and there is a iconic course. Unacademy Plus, you get all live classes access, live tests, live quizzes, and batch courses. I just showed you, for example, there was a batch course on CNS, etc. Right? An example, my course on gastrointestinal physiology, it has a live classes. It also has live quizzes. Okay. Then you get structured schedule. ठीक है, तो पूरा प्रॉपर स्ट्रक्चर के साथ बनता है. जैसे फॉर एग्जांपल आई शोड यू माय कोर्स शेड्यूल ना 22nd से 25th. तो सिमिलरली ऑल कोर्सेज हैव अ स्ट्रक्चर्ड शेड्यूल एंड एजुकेटर्स हैव टू अडहियर टू दैट. ठीक है, एक बार जो बोल दिया वैसा करना पड़ेगा. फिर उसके बाद अनअकैडमी आइकॉनिक. नाउ व्हाट इज अनअकैडमी आइकॉनिक? Unacademy Iconic is one step ahead. Alright. For those people who want to stay ahead, it is a combination of Unacademy Plus and Prep Ladder. So why is this combination there? Because see, Unacademy is already India's largest online learning platform and it is relatively new to this field. Prep Ladder is an established medical preparation app, top medical preparation app where you have teachers like GRG sir, Apurv Mehra sir who are teaching for so many years and they are the gold standard for pharma and ortho respectively and everybody likes to learn from them. ठीक है, तो GRG prep ladder is something that you have to take if you are serious for preparation. ठीक है, so I will recommend that you take the Unacademy Iconic subscription where you not only get everything of Unacademy Plus but you also get all the video lectures of the entire updated question bank 2.0 rapid revision course and handwritten notes for the entire duration. ठीक है, handwritten notes otherwise they cost 6500 if you order them separately. ठीक है, so have a look here. Iconic subscription costs 55,000 for 1 year. Then you have a 2 year plan, then you have a 3 year plan. It only makes sense to take these plans right now because that's how your PG entrance is scheduled. 1.5 abhi mat lo, I would not say. So give it a trial if you want. 1 year ka trial though. Referral code that you have to use is my referral code, that is Chetanya 10. Okay, now why to use this referral code? See, the cost was 55,000. It became 49,500. So you got a discount of rupees 5,500 straight away. ठीक है, cashback नहीं है, सीधा discount है, 10% off. Besides that, if you accumulate credits by watching free videos on Unacademy, you get another 10% off using credits. ठीक है, तो 20% off is possible here. If you have any doubts regarding discounts or you want to talk to me about anything related to this, you can contact me on Instagram at the rate chetanya.blue. Yeah. And you can contact me on Telegram. My Telegram channel is at the rate NEET PG Chetanya. Alright, so these are two things. Please keep these in mind where you can contact me and see. if you are paying, let's say for 3 years, I know 82,800 is a very big amount. Okay? Even though if you use a cashback, this will come down to rupees 75,000. This credits based on credits. Okay? This will come down to rupees 75,000. If that is there, it is still a very big amount. So the best thing here is that you have no cost EMI available on all plans that are above 6 months. So all plans of Iconic have no cost EMI, which means that you can split this 75,000 payment into 36 installments. Okay, no cost EMI. This is available in monthly or 3 monthly, 6 monthly. Okay, you can pay it in parts. Then what is the NEET PG Plus subscription? 1 month, 3 month, 6 month. ठीक है, तो यहाँ पे 3 month का ट्रायल दे दो. या फिर if I was saying that if you are preparing for your profs which are there in January, right? If they're in January end, you can take the 3 month subscription. If they are in January starting, or if they are in December end, take the 1 month subscription. Okay, and watch the plus courses. Take advantage of this. So this will not even cost you 5,000. This will come down with my referral code Chetanya10. You will apply. This will cost you 4,500. And if you use credits, apply credits, this will come down to rupees 4,000. Just contact me. I will help you out. Okay. So 4,000 rupees. Take maximum advantage of that. See, this is the option where you have to enter the referral code. You have the option to enter the referral code here, Chetanya10. Just click on apply and see, this is where you have credits. You can redeem credits for up to a 10% discount. And do this on Android only. Do this on Android or desktop. On iOS, what it does is it does not give you an extra discount. On iOS, it will give you extra weeks. ठीक है? तो iOS पर मत करना, कोई फायदा नहीं होगा. ठीक है? That is how you enter the referral code. It shows as referral code has been applied. Okay? This is a comparison of the subscription plans. So let's move to today's quiz. I hope you guys are ready. Right. Question number 101. What are your answers, guys? Okay. So, Sangeet, what is azygous slope? Can you also tell me what is azygous slope? Where have you read azygous slope? So again, this will seem like a question of anatomy, but this is a question of clinical anatomy. Okay. So in your clinical anatomy points, you will find that there is a variation called as the azygous slope of the lung. What is the azygous slope of the lung? Okay. So the answer is azygous slope is found in the lung. Just have a look at this image. Right. So what does the superior azygous? So what does the azygous vein do? Azygous vein, it courses around the loops over the root of the right lung to enter SVC. To enter SVC. But sometimes what happens is during this process it passes somewhat abnormally. It passes somewhat abnormally. Not any extra lobe of the lung, right? It is an extra lobe of the lung which is created due to the displacement of azygos, right? So this was the, it is only there in the right lung. It is there in the, possible only in the right lung. Okay? And it is a pathological condition. It is a pathological condition. There are some problems related to it. Okay? usually formed by the arch of the azygous vein. Absolutely correct. When it drains into the SVC, during that time it is formed. The middle lobe, this is the superior lobe, and now this lobe that has been created, it is the azygous lobe. Okay, that's about the azygous lobe of the lung. Question number 102. Okay. So Sangeet, Raja Pavan and Zubair have answered that the blood supply of the thoracic part of the esophagus, it is from the aorta. It is from the aorta. Right. So you guys are all correct. All three of you, you are correct. The blood supply of the thoracic part of the esophagus is from the aorta. So just have a look here. What are the arteries that actually do supply the aorta? This is the inferior thyroid artery, right? The inferior thyroid artery, it comes from the, so this is the first part of subclavian. It gives the VIT branches. So this is the thyrocervical trunk, and from that you have the inferior thyroid artery arising, right? You have the inferior thyroid artery arising, and then it gives an esophageal branch which supplies the upper part of the esophagus, right? So both sides they will anastomose the inferior thyroid artery. Then you have the esophageal branch of the inferior thyroid artery. Then you have the supply from the right bronchial, left bronchial arteries. So the bronchial arteries they will also supply the esophagus. Bronchial arteries they will also supply the esophagus. And the aortic esophageal arteries they also do supply the esophagus, right? So they are the main supply for the thoracic esophagus, and these were the options here. So you can see the options. The thoracic part of the esophagus. That's why you're not choosing inferior thyroid artery. You're not choosing gastric artery because that supplies the abdominal part, right? And superior thyroid artery does not supply the esophagus, right? So once you come below the diaphragm, here the left gastric artery is there and it has few ascending branches. So they will also go through this esophageal opening and they will supply the esophagus, right? That's regarding the blood supply to the esophagus. Okay, please keep this diagram in mind. Blood supply to esophagus. Question number 103. So Sangeet has been answering, Zubair has been answering, Rajapavan has been answering. Okay. So today I'm getting a lot of correct answers. Seems like you guys have studied. You guys studied for this? Did you guys study for today's session? Although this question was also in the first part, question was also there in the Thorax MCQ part 1. Fossa ovalis closes because of the fusion of, right? So all of you have given the correct answer. Sangeet, Zubair, and Rajpavan. The answer is going to be septum primum plus septum secundum. So you can have a look here. What happens? The septum primum forms towards the left atrium. Septum secundum, it forms posteriorly towards the right atrium, and then there is a fusion which causes a closure of the fossa ovalis. The closure of the fossa ovalis, septum primum, septum, the patent foramen ovale. Sorry, closure of foramen ovale to fossa ovalis. So this is a patent foramen ovale. Okay. The fusion of septum primum and septum secundum is a must for the fossa ovalis formation. Okay. Let's move to 104. Okay, great. So today we're getting answers faster than I expected. So the vein in the cardiac anterior interventricular groove. The vein in the cardiac anterior interventricular groove. Vein is the, I told you on the left side. So I told you how to remember this kind of. Let's go. The answer is right. All of you. The answer is great cardiac vein. A, option A. Right. So I told you this that say for example this is the coronary sinus. Say for example this is the coronary sinus. So the vein that comes from the left side, the veins that comes from the left side is obviously more larger, needs much more supply from the coronary vessels. So it will generate much more waste. So from the left side you have the great cardiac vein. From the left side you have the great cardiac vein. From the right side you have the small cardiac vein. From the right side you have the small cardiac vein. Right? Because the right side is smaller. Here you have the small cardiac vein, and in the center you have the middle cardiac vein. The center you have the middle cardiac vein, right? So, which one accompanies the left anterior descending artery? That is basically the anterior interventricular artery. That's another name for the anterior interventricular artery that was asked in the question. This is where it runs, right? This is the posterior interventricular groove, right? So this is the posterior interventricular artery plus the middle cardiac vein. So they accompany together. Middle cardiac vein, it accompanies the posterior interventricular artery. Whereas if you look here, this is the anterior interventricular artery. This runs in the anterior interventricular sulcus. So this is the great cardiac vein with the left anterior descending artery, and it also accompanies. This is the course of the circumflex artery. So it also accompanies the circumflex artery. Right? That's the information about the cardiac veins. Yes. left descending artery or left anterior descending artery or the anterior interventricular artery. It's all the same thing. ऐसा लिखा हो सकता है is equal to LADA equal to anterior interventricular artery is equal to widow's artery, right? So these are all names of the same artery. Okay. Question number 105. Guys, those of you who are watching, I hope you're liking the session. Please do hit the like button on this video. Right. So, how many of you have answered? Zubair has answered. Sangeet has answered. Raj and Pavan have answered. Yes, there are 12 people who are live. 12 people are live. So, I want more answers. I want more people to answer. Somebody else who thinks that there is a different answer? Because these three, they are killing it. They are giving the right answers for every question and they are giving them at a speed that is too fast. Right? So the answer is thoracodorsal artery. That's absolutely true. Blood supply of the breast is by all of the following arteries except. Were you guys able to read except although? I'm worried how were you able to answer? Were you able to read except? I did not say except, right? Did I say except? How were you able to answer without except? Okay. So the blood supply of the breast, it is by all of the following arteries except. The question says except. So there are three arteries that supply the breast. There are three arteries that supply the breast. Thoracoacromial. What are the four branches of thoracoacromial? A, P, C, D. Right? It's not A, B, C, D. It's A, P, C, D. A, P, C, D. A is acromial branch. E is pectoral branch. C is clavicular branch and D is deltoid branch. Right? So the pectoral branch of thoracoacromial, it will supply the breast. In the lateral thoracic artery, it is a branch of the axillary artery. It supplies the breast. The internal thoracic artery, it is a branch of the subclavian artery. It supplies the breast. Okay. Thoracoacromial artery is also a branch of the axillary artery. In part, yeah, have a look. Yeah, so which is the thoracodorsal artery you guys are asking in the chat? So thoracodorsal artery is actually an artery also. It's a nerve also. It's an artery also. So whenever you read the word thoracodorsal, it is written for which muscle? latissimus dorsi. It is written for latissimus dorsi, also called as the climber's muscle. So there is a thoracodorsal nerve and there is a thoracodorsal artery. Okay, so you guys tell me about both things. Thoracodorsal nerve. It's a branch of thoracodorsal nerve is a branch of. Tell me and tell me thoracodorsal artery is a branch of. Let me get a handkerchief. My nose is flowing a little. Sorry, excuse me. Guys, it's a cold season. To stay well, take a lots of water. Try to stay well covered because there's a high probability you will catch a cold and you don't want to fall sick. COVID का टेस्ट करा देंगे. Right? That's one of the reasons you don't want to fall sick. Right. So Sangeet MK has written and Raja Pavan has also written. Okay. So thoracodorsal nerve, it is a branch of the posterior cord of the brachial plexus. That's absolutely correct. It is a branch of the posterior cord of the brachial plexus. Posterior cord of brachial plexus. So the mnemonic is stars. The mnemonic was stars. So this T here, it is the thoracodorsal nerve. Now what about here? Thoracodorsal artery. Thoracodorsal artery is a branch of the subscapular artery. It is a branch of the subscapular artery. And subscapular artery, it is a branch of the third part of the axillary artery. It's the largest branch of the axillary artery. Okay. So that's about thoracodorsal nerve and thoracodorsal artery. Look here. This is the subclavian. This is the subclavian, right? This is the subclavian. And here you have the artery continuing downward. That is the internal thoracic artery. Internal thoracic artery, what it does is, internal thoracic artery, it gives perforating branches here, right? And these branches, they will supply the breast. They will supply the mammary gland. Okay, so these are branches from the internal thoracic artery. And if you this, so this is coming from the subclavian, right? Somewhere here you have the start of the axillary artery, and then you have the superior thoracic artery, thoracoacromial artery, and the lateral thoracic artery, which give a blood supply here to the breast. Okay, even the superior thoracic artery will supply it. So these are the arteries that supply the breast: the thoracoacromial, lateral thoracic, internal thoracic. Some supply also comes from the posterior intercostals. Okay, and this is the venous drainage. You can make out the venous drainage. Guys, why did you retract your messages? Posterior cord was right, axillary artery was also right. I don't understand that, but question number 106. Is it a multi-answer correct? Is it a multi-answer correct? Or is it not? Okay. So again, I'm getting answers by Raj Bhavan, Sangeet, and Zubair. Very good, guys. Keep going. You guys are doing great. All of you have said that the answer is D, subclavius. So who am I to say that you guys are wrong? So have a look at how this goes. So let's say this triangular kind of a bone that I've drawn here. This is the clavicle. The clavicle. So what happens is that there is a muscle here. There's a muscle here called as the subclavius. There's a muscle here called as the subclavius. Subclavius. Why it is called as the subclavius? Because it is present below the clavicle. Sub means below. Clavius means refers here to clavicle. Okay. Subclavius. There's another deep muscle here called as the pectoralis minor. There's a muscle here called as the pectoralis minor. In front, you have a muscle called as the pectoralis major. There's a muscle here called as the pectoralis major, right? So what happens? What happens? What is the reflection here of the fascia from the clavicle comes down? It covers the subclavius, right? It covers the subclavius, moves down, and it encloses the P minor. It encloses the P minor, then it forms the suspensory ligament for the axillary fascia, blah 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 blah. ठीक है ऐसा कुछ होता है. This is the pectoral fascia, right? This is the axillary. मैं क्लास ले रहा हूँ बाद में करते हैं. क्लास ले रहा हूँ बाद में करते हैं. Yes, right. So as pectoralis major, it is not covered by the clavipectoral fascia. So it's not a multi-answer correct. Has there been an option called as pectoralis minor? Had there been an option called as pectoralis minor, then this would have been both D and E. Okay, keep that in mind. So look at this. This is the clavicle. This is the subclavius muscle enclosed by the clavipectoral fascia. Comes down, encloses the pectoralis minor. Comes down, forms the suspensory ligament for the axillary fascia, which keeps the axillary fascia in shape. It maintains the fold of the axillary fascia, the floor, right? And then the axillary fascia, it comes here. This is the anterior axillary fold over the pectoralis major. This is the pectoral fascia over the pectoralis major, which goes and attaches on the clavicle. Yeah, so that is how you have to look at this clavipectoral fascia. What are the structures piercing clavipectoral fascia? What are the structures piercing clavipectoral fascia? What are the structures piercing clavipectoral fascia? हाँ जी राजपावन बताओ. स्ट्रक्चर्स कौन से पियर्स करते हैं? मौनिक बता दो जल्दी से. Okay, lateral pectoral nerve. ठीक है, so there are four structures that pierce. TL, TL, cephalic vein, lateral pectoral nerve. T is for thoracoacromial artery and L is for lymphatics. ठीक है, these are all the structures that pierce it. Not the lateral thoracic artery, it's the lateral pectoral nerve. The lateral thoracic artery नहीं भाई, lateral pectoral nerve. Zubair, be careful. Here L is lateral pectoral nerve, not the lateral thoracic artery. Okay, let's move on to question number 107. Let's move on to question number 107. Okay, hi Anurag Joshi. You all are saying option B, right? That's absolutely true. The limbus of fossa ovalis, it is a remnant of septum, secundum. It is a remnant of septum. Anyone else who wants to answer? Where is the limbus fossa ovalis located? कोरोना के सिम्टम्स लग रहे हैं, सिर्फ जुकाम है यार, कोरोना के सिम्टम्स तो नहीं है अभी। एक बार लग रहे थे, मेरी बहुत फट गई थी, बट अभी तो नहीं लग रहे। हो नहीं सकता यार, मैं रूम से बाहर नहीं निकला हूँ एक्चुअली। होने तो नहीं चाहिए, मतलब होने को तो हो सकते हैं। क्वेश्चन 108। आंसर दिस वेरी केयरफुली, ठीक है? एक तो मैं वर्ड नहीं दिख रहा होगा, एक्सेप्ट, ठीक है? हाँ जी, अनुराग अभी एम्स में है। ओके, तो बहुत सारे आंसर्स मिल गए अब तो मेरे को। राज पावन इज सेइंग ए एंड डी, एंड संगीत इज सेइंग बी, जुबैर इज आल्सो सेइंग बी। कोई सी भी बोल दो। उत्सव इज आल्सो हियर। उत्सव नाउ आल्सो हैज अ प्रोफाइल पिक्चर, वेरी गुड। ठीक है, सो ऑल ऑफ यू आर सेइंग बी, राइट? You all are correct. The answer is definitely going to be option B. So, coronary sinus, it opens into right atrium. That's true. Coronary sinus opens into right atrium. Now, anterior cardiac veins, yes, they will also open into right atrium directly. They open directly onto the anterior walls of the right atrium. Yeah. Then what about venae cordis minime? What are venae cordis minime? They are Thesbasian veins and they open into all chambers of the heart. They open into all chambers of the heart. Okay. So not just into the right atrium, but since they also open directly into the right atrium, we will not count them is the answer. So the correct answer is oblique vein of the left atrium, also called as oblique vein of. Is it also called as oblique vein of Marshall? Yeah. And oblique vein, it drains in, it is a tributary of the coronary sinus. It is a tributary of the coronary sinus. So it drains into the coronary sinus and then the coronary sinus drains into the right atrium. So it does not drain directly into the right atrium, it drains indirectly into the right atrium. So directly it drains into the coronary sinus. So that's going to be your answer. Question number 108, the answer is option B. Drains from the walls of all chambers of the heart, it drains into all chambers of the heart. Yes. Yeah. So have a look here. This is the oblique vein of the left atrium. This is the oblique vein of the left atrium. It is coming and joining into the coronary sinus. Yeah, besides that, you can see what are the other structures. Great cardiac vein, left marginal vein, there is the middle cardiac vein, right? All of these structures you can make out here. This is a posterior view. This is a posterior view. Question number 109. Can we have break only for 5 minutes? Okay. Zubair, let's have a break at question number 110. Zubair, break for 5 minutes at question number 110. Okay, just two questions. Let's finish quickly and then we'll take a break for 5 minutes. Done. This is very similar. Just answer this quickly. Okay. So 109, Raj Pawan and Zubair have answered correctly as option D, middle cardiac vein. Even Sangeet has answered C. Anterior cardiac vein, I just told you it opens into the right atrium. Vena cordis minima, they also open directly into the right atrium. Coronary sinus also opens into the right atrium. It's very similar to the previous question. The only difference is you definitely know that the middle cardiac vein, it goes into the coronary sinus and then it goes into the right atrium. So it's a very simple answer. No doubts about it. Even Utsab has answered. Again, this question should not take this much time. It should be a quick answer, right? So you can see here the middle cardiac vein, it drains into the coronary sinus, right? Question number 110. Okay, what you guys can do is leave your answers. Answer kar do. Chalo, I'm waiting for your answer. Cardiac septum. Cardiac septum develops by what week? So again, this is so embryology of CVS. It's very important. I will say more important than a lot of other embryologies. Embryology of CVS is undoubtedly very important. और किसी चैप्टर की एम्ब्रियो पढ़ो ना पढ़ो सीवीएस की जरूर पढ़ लेना. Crux of the heart. Okay. 16 to 18 weeks. Wrong. What is the meaning of crux? Okay. Varied answers. Utsav is saying C 9 to 12 weeks. Okay, I will tell you that's again wrong. Sangeet, MK and Tejaswini talks. You guys are right. The answer is 5 to 8 weeks. That is the period of organogenesis of the heart. Right? That is the period of organogenesis of the heart. So that's the answer for cardiac septum develops by. So the answer is going to be 5 to 8 weeks. Okay, embryo वाले part से है, not going into the details of this particular question. Okay, but wait, before that, somebody has said that I have to explain what is the crux of the heart. So first, tell me what is what is the definition of crux of the heart, and then I'll show you in this model. Crux of the heart, it is a point of, it's a very important surgical anatomical landmark. Why? Because it is where the coronary sinus, or I will say the coronary sulcus or the coronary groove, it meets the posterior interventricular groove, right? Basically, if I look at the back of the heart, if this is the back of the heart that I'm looking at, यहाँ पे posterior interventricular groove जा रहा है, यहाँ पे coronary sulcus जा रहा है. तो ये जो cross बन रहा है यहाँ पे, this cross cruciform that is being formed, ठीक है? Why it is called as crux? Because it resembles cruciform. That is the meeting point of the coronary sulcus and the posterior interventricular sulcus. So that is why it is called as the crux of the heart. So which is the vein that runs in the coronary sulcus? It's the coronary sinus. So it is the coronary sinus, and which is the vein that runs in the interventricular, posterior interventricular sulcus. It's the middle cardiac vein. So it's the middle cardiac vein. So how do you identify the crux of the heart? This is the middle cardiac vein, the vein that has been shown to you. This is the middle cardiac vein, right? This is the middle cardiac vein, and this is where the point it enters the coronary sinus. So this point is basically the crux of the heart. This point is the crux of the heart. What is the importance of the crux of the heart? What is the importance of the crux of the heart? So first important point regarding the crux of the heart. There are two important points regarding the crux of the heart. First point, second point. First important point is that it is the site of anastomosis between the left and the right coronary artery. It's where the left coronary artery meets the right coronary artery. Okay. Second important point, the AV nodal artery, which comes from posterior interventricular artery, it passes very close to it. So that's why it's very important surgically. You have to be very careful here, otherwise you might cut this off. Okay. So these are the two important points regarding the crux of the heart. Now on public demand, let's take a break. On demand of Zubair Ahmed, make it a black screen. 5 minute break. Let's take a 5 minute break from 5:04 to 5:09. Okay. We'll meet at 5:09 again. Meanwhile, if you have any doubts, ask me. Talk about anything, you can ask me. या पानी पी लो आराम से अपना वॉशरूम जाओ बिल्कुल असली क्लास वाली फीलिंग आ रही है ना 5 मिनट का ब्रेक ले रहे हैं पानी वगैरह के लिए एक ब्रेक ड्यूरिंग अ क्लास मैराथन टूट जाती है It's 5-9. We're back. Let's start again. सर्कस टर्मिनालिस की भी इंपॉर्टेंस सिमिलर है, सोचो थोड़ा। क्रक्स ऑफ द हार्ट की जैसी इंपॉर्टेंस है वैसी ही सर्कस टर्मिनालिस की इंपॉर्टेंस है. We have a question today on sulcus terminalis also. It's 5-9 guys. I hope you guys are back. We're moving on to question number 111. Zubair, are you back? ऐसा तो नहीं है 5 मिनट की ब्रेक लेके तुम गायब ही हो गए. What is torus aorticus? Sub is saying that the answer is A, bulge in the atria. The answer is A, bulge in the atria. Okay. What is this bulge because of? Now, even Anurag Joshi has also got an answer. The answer is bulge in the atria. What is this bulge due to? What is the reason of this bulge? So any bulge or any swelling in a internal structure, it is usually due to the presence of something behind it, right? For example, your facial colliculus. For example, your facial colliculus. थर्ड प्रॉफ तो होता ही नहीं है यार एम्स में. Yeah, so this bulge in the atria is due to some reason. Okay. So look here. This is the this is the aorta. This is the aorta, right? And your aorta, it is divided into three. It is divided into three. This is called as the anterior aortic sinus. This is called as the left posterior aortic sinus, and this is called as the right posterior aortic sinus. So from the anterior aortic sinus, you have the origin of the right coronary artery. You have the origin of the right coronary artery. From the left posterior aortic sinus, you have the origin of the left coronary artery, right? So from both these aortic sinuses, you have the origin of one coronary artery. But from the non-coronary aortic sinus, that is the right posterior aortic sinus, from the right posterior aortic sinus, you do not have the origin of any coronary artery, so it is called as the non-coronary artery. It's called as the non-coronary artery. And there is a bulge in the right atrial wall, right? And that is called as the aortic mound or the torus aorticus, which is the projection of the non-coronary aortic sinus into the right atrium. Okay, so just keep that into mind whenever you are talking about the torus aorticus. It is because it is a bulge because of the non-coronary sinus. It's a very uh, good question that can be asked because a lot of people they probably won't know about the torus aorticus. Okay, question number 112. .cs. This is C5. This is also C5. Root value of the phrenic nerve. Right. So everyone has answered. Anurag, Sangeet, Utsab, Rajapavan, Sam, Zubair. Very good. So the answer is option B, C3, C4, C5. That's absolutely correct. That's the root value of the phrenic nerve. Now my question to you is the accessory phrenic nerve. It is a branch of which nerve? Accessory phrenic nerve. I am sure nobody of you will be able to answer. Accessory phrenic nerve is a branch of. I taught this in my lecture on brachial plexus. I taught this in my lecture on brachial plexus. Taken a lecture for the nerves of the upper limb. Not answer subclaviculis. Yes, right. So it is a branch of the nerve to subclavius. It is a branch of the nerve to subclavius. That's absolutely correct. No. All of you were able to answer. I'm really surprised. Have you listened to my lecture on brachial plexus? Is that why you were able to answer? Question number 113. Trachea is lined by. Trachea is lined by. Per se, this question is from histology, but I would say this question is from class 11th. This is from your class 11th knowledge of animal tissue. Very simple question. Rajpavan is saying no. No, not from class 11. Okay, so respiratory epithelium, typical respiratory epithelium. So it's a very detailed description, pseudo stratified. डिटेल्ड तो बेसिकली क्या है, थोड़ा सा और डिटेल है. Pseudo stratified columnar glandular ciliated. So they have written two words, pseudo stratified columnar. There are two other words, glandular and ciliated. That's how you are going to write respiratory epithelium. Pseudo stratified columnar glandular ciliated epithelium, or PGCCE, whichever way you want to write it. Pseudostratified, columnar, glandular, ciliated. So these are the four characteristics that you have to write whenever you are writing respiratory epithelium. Okay. Question number 114. So even Sangeet, you have not written the entire thing. It is pseudostratified, ciliated, columnar, glandular epithelium. So four terms. Four terms have to come. Okay. Where is saying A, Rajapavan is saying B, Sangeet is saying A, Sab is saying B. Wow. Zubair और संगीत कह रहे हैं ए, राजापावन कह रहे हैं हो गई गड़बड़, आंसर तो एक ही होगा. गड़बड़ हो गई है भैया, एकदम गंभीर गड़बड़. देखो, फर्स्ट फेज मेरे हिसाब से तो देखो इनमें से कोई भी नहीं है. ठीक है. Your traditional books they write that there are four phases of lung development. That there are four phases of lung development. Your good books they write that there are five phases. There are five phases of lung development. There are five phases of lung development. ठीक है. Your good books they write that there are five phases. So whenever you are getting a question in your profs regarding what are the phases in lung development, that is how you have to go about. First phase is embryonic phase. Second phase is pseudoglandular. क्या जो मीडियोकर बुक्स होती है वो चार फेजेस लिखती है, जो अच्छी बुक्स होती है वो पांच फेजेस लिखती है. Pseudoglandular, canalicular, saccular, alveolar. ठीक है. तो ट्यूबुलर इज नॉट per se a phase here, right? So the first thing is that during the five phases, what are the five phases? You have to keep in mind. The first phase is embryonic, second phase is pseudoglandular, third is canalicular, fourth is saccular, fifth is alveolar. ठीक है. तो alveoli लास्ट में बने, alveolar sacs, canaliculi, pseudoglandular. ठीक है. So initially what happens, initial few weeks till pseudoglandular, you have the formation of the major airways, bronchial tree and respiratory parenchyma, and birth of the acera. So that's the phase where you have organogenesis. The phase for organogenesis from 3 to 16 weeks. There is a phase of organogenesis for 3 to 16 weeks. Then differentiation goes on from 16 to 36 weeks. Alright, and after that you have the alveolar phase. After that you have the alveolar phase where you have secondary septation. Yeah. तो क्या होता है उसके बाद? A lot of developments that you have to keep in mind. Surfactant is one of the major ones. Around 25 weeks you have the surfactant detectable in the amniotic fluid. Surfactant production starts. ठीक है. ये surfactant वाला एक point embryo में थोड़ा ज़्यादा important है because that will that is a clinical anatomy point related to preterm babies. ठीक है. ये preterm babies के लिए relevant होता है. कैसे relevant होता है? I'm not going into the details. ग्लूकोकॉर्टिकॉइड्स वगैरह एडमिनिस्टर करने पड़ते हैं preterm babies में because of this reason. ठीक है. So that's about this answer. So first phase, the best option here is pseudoglandular. If embryonic was there in the options, if embryonic was there in the options, I would have gone with embryonic. Yeah. Hyaline membrane disease or respiratory distress syndrome. That's true. सही बात. 115. Third coronary artery is, which is the third coronary artery? Vueson's artery. Okay, Sangeet MK is saying Vueson's artery. Okay. So who is saying left anterior descending? Raja Pavan. Utsab, Sangeet, and Zubair are saying Vueson's artery. Where? Now tell me, why are you guys saying Vueson's artery? Because इसका नाम अजीब है. Is that why you are saying it? Because it has a अजीब सा नाम, इसलिए बोल रहे हो? Third coronary artery. What do you know about the Vueson's anastomosis? Vueson's anastomosis होता है. Vueson's anastomosis is between which arteries? Vueson's anastomosis. LADA is the third branch of the left coronary artery, I guess. No? Left coronary artery divides into two. Third branch कहना कह लो, but main two branches है left coronary artery की. Left anterior descending artery and दूसरा left circumflex artery. Third कैसे बोला? बीच में से तुमने कोई arteries निकाल के third बोल दिया इसको. Anyways, this question is asking the third coronary artery. So there are, you know about two coronary arteries. Yes. Circle of Vueson's. That's absolutely correct. Is present between, no, not two coronary arteries. Okay. Is present between the left and the right conus arteries. ठीक है, left and the right conus arteries. Wait, do you want me to show you? Do you want me to teach you this? Right, have a look here. This is the right coronary artery. This is the right coronary artery coming from the anterior aortic sinus. This is the right coronary artery. Okay. What is one of the first branches of the right coronary artery? It's the right conus branch. Okay, conus branch of the right coronary artery. It's the first branch of the right coronary artery. Okay. From the left coronary artery, this is the left coronary artery. It also gives a conus branch. Okay. Conus means it supplies the conus arteriosus, right? That's the initial part of the pulmonary trunk. That's the initial part. It's the original origin जहां से होता है ना pulmonary trunk का, जहां से arise होती है वो वाला part. So from the left side also you have a supply for that. That's the conus branch of the left coronary artery. See here, this is the anterior aortic sinus. वहां से आ रही है right coronary artery and यहाँ से आ रही है left coronary artery. So this is the right coronary artery coming down, and this branch that it gives is the right conus branch. It's the right conus branch. This is the left coronary artery. It gives a branch here that is known as the left conus branch. The anastomosis between these two. So this looks like what? This looks like a necklace. ठीक है? Imagine the pulmonary trunk is a neck. Mannequin वगैरह देखे हैं? If you have seen a mannequin at a jewelry store, doesn't this look like a necklace, right? Around the root of the large vessels. This is the annulus of Vueson's. That's why it's called the annulus of Vueson's, because it resembles a necklace. It resembles a necklace around the neck. ठीक है? Around a neck. Okay. Necklace जैसी resemblance होती है इसकी, and that is why it is known as the annulus of Vueson's. ठीक है? Now, what is known as the third coronary artery here? See, sometimes what happens is that instead of coming from the right coronary artery, the right conus artery, it may arise directly from the anterior aortic sinus. It may arise directly from the anterior aortic sinus, the right conus artery. Yeah, that is why it is also sometimes called as the third coronary artery. So if I say a person has three coronary arteries, what are the names of those arteries? The third artery will be called as the right conus artery. The third coronary artery will be called as the right conus artery. So the answer is conus artery. 115, the answer is option C, conus artery. Okay, that's going to be your answer. Clear? Here with this explanation, what all have you learned? What is the annulus of Wiesen's or the Wiesen anastomosis? And you now know about the third coronary artery. Okay. तो इसीलिए MCQ सॉल्व करके लाइव पोल कंडक्ट करके डाउट्स पता चलते हैं और कंसेप्ट्स क्लियर होते हैं, नई चीजें पता चलती हैं, तो इसलिए MCQ सॉल्विंग डिटेल में करो हमेशा. डोंट जस्ट लुक फॉर द आंसर, लुक फॉर द एक्सप्लेनेशन. चलें आगे. Shall we move ahead? ओके, क्वेश्चन नंबर 116 आ गया तुम्हारा क्वेश्चन जो तुम पूछ रहे थे, बहुत बेरहमी से पूछ रहे थे, है ना? Right, so you all have been able to answer. Rajpavan, Sangeet, Zubair, and Utsab. The answer is upper end of crista terminalis. So now you've realized the significance of the upper end of crista terminalis. So first thing that it has some embryological significance. First thing, it has some embryological significance. It is the mergence of sinus venerum with the primitive atrium. With the primitive atrium, that's one of the things that it marks. ठीक है? तो बाहर होता है crista terminalis. ठीक है? अंदर sulcus. That's the upper end of crista terminalis. That's where SA node is located. उल्टा बोल दिया क्या मैंने? Can you be a little fast? Okay. Hello. Question number 117. My speed is determined by your speed of answering. Besides that, It's just explanations. Smooth and trabeculated portion of the right atrium are separated by the crista tuberans posteriorly. Right. Inflow and outflow tracts का separation कह लो जिसको. Hmm. So what does PGI type mean? Because previously PGI exam used to be there and it has multi-answer correct. Multi-answer correct. Yeah, so give me multiple answers correct, not one. Yeah. Now there's a common entrance examination this year, INI-CET, and soon everything will be replaced by the next PG entrance. Next. You are saying A and B. Sangeet has given the right answer, first of all. Zubair's answer was wrong. It's not the left pulmonary artery. Fourth arch, it forms what? Okay, fourth arch, why is it important? I'll tell you. Because fourth arch of one side, what happens? Right, B, not B and E, not the right and the left subclavian arteries. That's wrong. See, that is why this is important. Because ऐसा नहीं है कि left और right पे same structure होता है fourth arch में. Left and right, they have different structures. D and E, I have told you, are wrong. A, B, C are left, are what are left. A and B are the correct answer. Okay. Zubair has changed his answer. Answer is going to be A and B. Aortic arch on the left side and subclavian artery on the right side. That's what is formed by the fourth arch. So look here. Look here. This is the derivatives of all the arches, right? So embryonically, these are the arches. 1, 2, 3, 4. 5 degenerates, then 6. This is 6. So what happens to the first and the second arch? There's barely anything left. Okay. So there is a ventral aortic root between aortic arches 3 and 4. Alright. And then this is the main aorta and everything, right? So this is the third one, right? This is the third one. Third one, it gives rise to, third one gives rise to internal carotid artery. Third one does give rise to internal carotid artery of the left and the right side. ठीक है, उसके बीच में तुम्हारी common carotid, it becomes from the ventral aortic root, right? And then when you talk about the this pink one, this is the pink one is the fourth one, right? Pink one is the fourth aortic arch. So from the fourth aortic arch, you have the left aortic arch. So from the fourth arch here, you have the left aortic arch, and you have the right subclavian artery. You have the right subclavian artery that comes. Okay. These are the two structures that arise from here. These are the two structures that arise from here. And that is why there is a difference in how the left recurrent laryngeal nerve courses and the right recurrent laryngeal nerve courses. The right recurrent laryngeal nerve, it passes under the right subclavian artery. It loops around the right subclavian artery. Whereas the left recurrent laryngeal nerve, it loops around the left aortic arch. So that is one significance. That is one significance here that you have to keep in mind. Okay. Left subclavian by 7th intersegmental artery. Wow. Okay, great. Yes, 6th aortic arch, ductus arteriosus, and also the right pulmonary artery. Okay. So this is the entire. So ये एक development है again. Like I said, CVS the embryology part is important. CVS embryology part is important. बहुत कुछ है इसमें याद करने को. Lot of exceptions, lot of structures that you have to remember. That's why the CVS embryology part is a little important. Question number 118. Most posterior structure seen in the root of the lung. So I'm getting varied answers. Zubair is saying superior pulmonary vein. Okay. Prashant is saying bronchus. Then Sangeet is saying superior pulmonary vein. And Utsav is saying inferior pulmonary vein. वाह 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 सारे आंसर मिल गए भाई. ठीक है. So 118, the correct answer I will tell you is given by the only person that has given the correct answer is person who was not taking part so far. That is given by Prashant Kumar Yadav. ठीक है. The answer correct answer is bronchus. ठीक है. First of all, see, it does not say left lung or right lung, which means it must be the same for both lungs. Which means that it must be the same for both lungs. Otherwise, he would have clarified. First point. ठीक है. So that is the thing that you have to see in the question, that he has asked the most posterior structure and he has asked in the root of the lung. Okay. So what is the general arrangement of structures whenever you talk about any region? VAN होता है हमेशा arrangement. Vein, artery, nerve. यहाँ पे बस N की जगह B कर दो bronchus. N की जगह B कर दो bronchus. That is the arrangement of structures from anterior to posterior. That is the arrangement of structures from anterior to posterior. Most anterior-inferior you have the pulmonary veins, and most posterior is the bronchus. Most posterior is the bronchus. Okay. General, मैं क्या बोल रहा हूँ? What am I saying? Key people, I am explaining this to you because you are getting these answers wrong. ठीक है, तो इसीलिए explanation is important. VAB, vein, artery, bronchus. ठीक है. Generally क्या होता है? Van होता है ना, vein, artery, nerve. Nerve को काटो, यहाँ पे लिख दो bronchus. That is the arrangement of structures. How you remember from anterior to posterior. देखो यहाँ पे, this is the root of the lung. This is the root of the lung. Which lung is this? I can identify based on this fact that there are the bronchus is divided into two. So this is the right root of the lung. This is the right lung. ठीक है. First thing. Second thing. What is the anterior most structure? ठीक है. Orientation क्या है? ये anterior है, ये posterior है. सबसे आगे anteriorly क्या है? You have the pulmonary veins, anterior most structure. Then what do you have? You have the pulmonary artery, and then you have the bronchus posteriorly. So what is the arrangement of structures? Vein, artery, bronchus, VAB. Okay, that's the arrangement of structures, right? Clear? Let's move ahead now. Question number 119. This has been asked in the DNB entrance examination. As in the DNB examination. Plus referral code that you have to use is going to be Chetanya 10. Zubair, Shant, Sangeet, Dr. Chandni Singh, Utsav, Rajpavan, everybody has answered correctly. यार मुझे तो ये क्वेश्चन मुश्किल लगा था बहुत. तुमने तो फट से बता दिया. देखो राइट का होता है और लेफ्ट का होता है, दोनों के एंगल होते हैं. लेफ्ट का ऑप्शंस में है, लेफ्ट का इज 40 to 50 डिग्री, 40 to 50 डिग्री, and right is 25 to 30 degree. Okay. The answer that you all are choosing, that is B, that's absolutely correct. So remember, the right bronchus, it is more steep. Right bronchus is more steep and left bronchus is less steep. Okay, so it's more horizontal. More horizontal. That's why the angle will be like this. एंगल कम है तो स्टीप ज्यादा होगा, ये चीज याद रखना. सी द एंगल इज मेजर्ड फ्रॉम हियर. This is the trachea, this is the trachea, and this is the bronchus. So this is going to be the tracheobronchial angle. Similarly on this side, this is going to be the tracheobronchial angle. ठीक है, ये वाला एंगल नहीं ले रहे हैं, एंगल ये वाला वर्टिकल के साथ. ठीक है, so it is more steep, so the angle is less. It's around 20 to 25 degree. This is greater than 35 degree. Okay, that's going to be your first thing. Second thing, how do you remember this? Always remember that right bronchus is more suitable for some particle to go inside it. Right bronchus, it is more suitable for a particle to enter the right lung. ठीक है, अगर तुम randomly कोई चीज right और left में गिरा दोगे, ट्रैकिया में गिरा दोगे, तो it is more probable that it will go to the right side. It is more probable that it will go to the right side rather than the left side. Why? Because right bronchus is wider, right bronchus is shorter, and right bronchus is steeper. So all of the factors favor that the particle goes to the right bronchus rather than the left bronchus. So isse remember about the angle that it is more steeper, so angle is lesser, so it's around 25 to 30 degrees. And this side it is around 40 to 50 degrees. तो ये ज्यादा हॉरिजॉन्टल होता है, ज्यादा लंबा होता है. ओके. Question number 120. Triangle of auscultation is seen in. Where do you see the triangle of auscultation? Triangle of auscultation, it is seen in the sixth intercostal space, according to Raja Pavan. Okay. Utsav is also saying that the answer is option B, that is the sixth intercostal space. That's right. Shall we move ahead? Both of you have said the right answer. 120B has been given by a lot of people, right? So, do you guys want to count or do you guys trust me? Do you guys want to count? This is where you will find the triangle of auscultation. Remember the borders: lateral border of trapezius, upper border of latissimus dorsi, and medial border of scapula. They will form the triangle of auscultation, right? Okay, so this is the sixth rib, this is the sixth intercostal space, that is the level at which triangle of auscultation is present. Okay, sixth intercostal. Okay, clear? Let's move ahead. Sangeet retracted his answer. Okay. I started receiving answers for 121. Raj Pavan, where Utsab, Samya Mantri, Pooja, सब लोग आंसर ए दे रहे हैं भाई सब लोग. चलो अब मैं तुम सबको बता दूं that your answers are wrong. ठीक है, मैं वेट कर रहा था कि कोई सही आंसर दे, but nobody has given the right answer. So all your answers are they are wrong. चलो अब एक ऑप्शन हटा दी. Now tell me your answer. What's your second answer? What's your second answer, guys? Tell me quickly. B, very good. B, C. ठीक है. E होगा correct answer. C. I didn't keep an image because I didn't think कि गलत होगा तुम लोगों का. Have a look at this image, right? Have a look at this image. So this is the area where the body of the vertebrae should be, right? This is where the body of the vertebra there should be. But the thoracic sympathetic trunk, it runs on the sides. It runs on the sides. That is in front of the head of the ribs, not exactly in front of the body of the vertebra. So that is why the answer is different. That is why you have to think a little. That is why you have to think a little that the answer is in front of the head of the ribs rather than being in front of the body of the vertebra. So that's something that you have to keep in mind. In front of the head of the ribs. ठीक है, so the correct answer for 121 is option B, not option A. Fine. 121. Answer is B. ठीक है. 122. Question number 122. अरे सब गलत कर रहे हो अब, क्या हो गया सबको? Even Zubair, Raj Pawan, you guys are making mistakes now. Sangeet is saying C. Raj Pawan is also saying C. Prashant is also saying C. Zubair is also saying C. So all of you guys, you are saying C. खाना पड़ेगा क्या इसका भी कुछ डायग्राम? The correct answer. Okay, so C कहाँ तक हो गया था? Zubair is now saying D and Utsav is now saying B. चलो ये एक जो ऑप्शन रह गया था यही है आंसर. सुपीरियर वेना क्या इज द करेक्ट आंसर. क्या थोड़ा जेनरिक क्वेश्चन है. Veins of pericardium that drain into the superior vena cava. Right? Question number 123. Select the statement not true with respect to transverse thoracic plane. With respect to the transverse thoracic plane. I've read the question for you. If you're not able to read something, it says transverse thoracic plane. It says transverse thoracic plane. Now, which plane is called as the transverse thoracic plane? That's the first thing. That's the first thing that you should know while answering this question. Which plane is called as the transverse thoracic plane? Okay. So what all happens in the transverse thoracic plane? Let's have a look at that. So no, I'll write it down only. So basically this is the plane for the sternal angle. This is the sternal angle wala plane. Okay? Sternal angle. The demarcation plane between. So what all happens at the sternal angle? Yes, it's the plane which separates the superior and inferior mediastinum. That's absolutely true. You guys are right. So how you should kind of remember this is that superior and medial inferior mediastinum वाला जो separating जो plane होता है that's same as the level of the sternal angle. ठीक है? So sternal angle से related there are a few points, few क्या 10 point है, 10 से 11 point है. And how to remember all those points? It is through a mnemonic that I have made. It is MAD RAT PP. Okay, so M stands for mediastinum. It means that it separates the superior and inferior mediastinum. A stands for a zygous vein. A zygous vein, it courses over the root of the right lung and enters the superior vena cava. D stands for thoracic duct. D for duct, because the thoracic duct, it courses from the right to the left at this level. R stands for ribs, because this is used to mark the second costal cartilage and can be used to count the ribs. A stands for aorta, because the arch of aorta starts here and it also ends here. Okay, which means that the ascending aorta, it ends here, and the descending aorta, it also starts here. So there are 3 points related to the aorta. T stands for bifurcation of trachea. T stands for pulmonary artery bifurcation, pulmonary trunk bifurcation. Okay, trachea bifurcates, pulmonary trunk bifurcates, and also you have the plexus. The cardiac plexus is here, the superficial and the deep at this level. P means it marks the upper limit of the base of the heart. It marks the upper limit of the base of the heart. Since the heart is present in the inferior mediastinum, marks the upper limit of base of the heart. Heart is present in the inferior mediastinum, so it is the upper limit of the base of the heart. So the chambers of the heart, they are located below the sternal angle level, right? They are located below the sternal angle level. So if I come back, the transverse thoracic plane, if I have a look at this, it is a demarcation between superior and inferior mediastinum. Yes, that's the point for M. Anteriorly from sternal angle to posteriorly T4 disc. Yes, T4 T5 level. True. It is a very important anatomical and radiological marking. True. Okay. Passes through the cardiac chambers. No, it marks the upper limit of the heart. Marks the upper limit of the base of the heart. E for base of heart. Please remember MAD, RAT, BP. Question number 124. Very easy question 124. It's a particularly easy question. Guys, all of you are watching. I hope you guys are liking the video. Can you hit the thumbs up button or the like button on the video? Like button. Yes, it says accept. It says accept. I'm sorry, I didn't tell you. It says accept. यार वो ना यहाँ पे वो आता है मेरा वीडियो और ये छुप जाता है ये वाला एरिया. Sorry. Actually, I asked Unacademy also if I could move the video here. They didn't let me do that for some reason. I think यहाँ पे Unacademy का लोगो आना होता है बाद में. क्या कर सकते हैं? So I'll ask them again. Maybe you can move it down. बाकी सब वीडियोस में भी टॉप राइट कॉर्नर में ही होता है ना. Yes, it says accept in the question, right? So a lot of people have given the answer Raj Pavan, Sangeet, and Utsav. The correct answer is option D, xiphoid process. That's absolutely true. It says superior thoracic aperture. ठीक है, superior thoracic aperture में T1 आएगा, first pair of ribs आएगा, manubrium का border आएगा, but xiphoid process तो कहीं से भी नहीं आ जाएगा. ठीक है, superior thoracic aperture तो यहाँ पे located है. This is where the superior thoracic aperture is, and this is where the xiphoid process is. This is where the xiphoid process is. इनका तो दूर दूर तक कोई लेना देना ही नहीं है. नो कनेक्शन. ठीक है, ये inferior thoracic aperture के आसपास है. ठीक है, so this is, you can clearly eliminate that the answer is going to be xiphoid process. You can do it without thinking that answer is xiphoid process. ठीक है, question number 125. इसकी वीडियो थी एक, देखी थी किसी ने? Did anybody watch the video that I had made for this mediastinal relations of the lung? Did you guys see this video that I had made for you all? I put it on my Telegram channel. Okay, I should read the question. Which of the following is related to the mediastinal part of the right lung? So the mediastinal part of the right lung. Sorry, I should have read the question because I forget that वो ऊपर वाला part दिखाई नहीं देता है आप लोगों को, because it is visible on my screen but it isn't visible on your screen. Also the options make this question very simple. ठीक है, option से ये question बहुत आसान बन जाता है. Otherwise this is a little difficult to remember the mediastinal relations. I explained it in a very simplified way so that you could imagine everything. If you want, I can cover it in 2 minutes. If you guys want me to cover it again, let me know. Chat में लिख दो कि explain and I will cover it in 2 minutes for both the right and the left lungs. If you guys have a problem in remembering this, otherwise I will move. Okay, so all of you are able to answer. I think except Mishti, everyone has answered correctly. Even Utsav has answered incorrectly. Arch of aorta. देखो राइट साइड पे क्या होता है यार, aorta होती है कि superior vena cava होती है? राइट साइड पे you have superior vena cava. So obviously related to the mediastinal relation of the right lung, you will have the SVC. You will have the SVC. 125, the answer will be option B, superior vena cava. Very easy. Very easy. ठीक है? So there should be no doubt about this. देखो. So this was a very concise PPT. We had finished everything in a very short span. ठीक है, देखो, important structures that you have to draw. See, first thing that remember, first thing, draw the esophagus and the trachea. ठीक है, कुछ समझना है तो esophagus का impression होता है और trachea का impression होता है. They are midline structures. They will have impressions on both lungs. They are midline structures, so they will have impressions on both lungs. Right? Okay, right. Sorry. Their midline structures, you will find their impressions on both lungs. ठीक है, first thing. Then remember that on the right side, what do you have? On the right side, you have the major vessel, that is the superior vena cava. ठीक है, right और left में compare करूँ, so right side has the arch of azygos, left side has the arch of aorta. Alright, so you can draw the superior vena cava, then draw the superior vena cava. Okay, and into the superior vena cava, draw the azygos vein that courses over the root of the right lung. Remember, we had studied this in the sternal angle. Over the root of the right lung, you have the arch of azygos vein draining into the superior vena cava. So that is the structure that is seen here. Now the superior vena cava, it is made up from the right and the left brachiocephalic vein. So you are able to make out the right brachiocephalic vein as an impression on the right lung. Okay. So superior vena cava, right brachiocephalic vein, arch of azygos vein. Okay. Those are the veins that you can see here. Besides that, what is the nerve? So there is a nerve that passes posterior to the hilum. There is a nerve that passes in front of the hilum of the right lung. Okay. Posterior hilum, कोई भी hilum हो, hilum of the right lung या left lung. In front of the hilum of the lung, what passes? Phrenic nerve. Behind the hilum of the lung, what passes? Vagus nerve, right? So remember that. So behind हम pass करा देंगे यहाँ से vagus nerve, which is coursing on the front of the esophagus. ठीक है, इधर से जा रही है esophagus के पीछे चली जाएगी फिर, और यहाँ से देखो आगे से कौन सी जा रही है, ये एक नर्व, लंबी सी नर्व, दैट्स द फ्रेनिक नर्व, दैट्स द राइट फ्रेनिक नर्व. ठीक है, सुपीरियर वेना कावा आ गई, तो और कौन सी वेना कावा आएगी? इंफीरियर वेना कावा. So you draw the inferior vena cava also. Superior vena cava is also done. What is this impression going to be? Where the superior and inferior vena cava are draining, that is obviously going to be the right atrium. Okay. So besides that, there are the structures in the root of the lung. Okay. So that is a gross idea of what are the structures in relation to the right lung. पीछे यहाँ vertebra वगैरह भी आएंगे relation में, that you can read from your textbook. When you talk about the left lung, what is the major structure that you have to draw? You have to draw the arch of aorta. I said arch of azygos in case of right lung, arch of aorta in case of left lung. So draw the arch of aorta, and you will also be drawing the descending aorta going posteriorly. Yeah, arch of aorta is coming from the left atrium, so this is the impression of left atrium, left ventricle will be here, right? Then branches of the arch of aorta, that is the left subclavian artery, left common carotid artery, they will also be seen at this level. Okay. Then I said draw the esophagus, draw the trachea. They are midline structures. They will be seen for both the right and the left lungs. Okay. Then here you will see the in front of the hilum you will have the left phrenic nerve passing. Behind you will have the left vagus nerve passing, and then the left recurrent laryngeal nerve, it will move above the arch of aorta. ठीक है. और यहाँ पे pulmonary trunk का bifurcation भी होगा. Okay, that will also be seen. And but that impression won't be there on the left lung per se, but जो ये recurrent laryngeal nerve ऊपर से जाती है, that goes between the arch of aorta and the pulmonary trunk, where you have the ligamentum arteriosus, ठीक है. And esophagus के साथ साथ there is the lymphatic structure called as thoracic duct running on the left side. Esophagus, thoracic duct, these are structures of the root of the right and the left lungs. Descending aorta बता दी, esophagus बता दिया. Left ventricle का impression होता है, left phrenic nerve, I've told you this is the structure for the in the root of the lung. Pulmonary trunk आ गई यहाँ पे, I told you pulmonary trunk का impression हो सकता है. Arch of aorta, branches of the arch of aorta on the left side, trachea, left recurrent laryngeal nerve. ठीक है. So these are all the structures that will be seen as mediastinal relations of the left lung. These are all the structures that will be seen as mediastinal relations of the left lung. So up you can completely answer this question that SVC is a mediastinal relation of the right lung. We just saw arch of aorta, pulmonary trunk, and left ventricle. They are mediastinal relations of the left lung. ठीक है. Pulmonary trunk का impression थोड़ा fade होता है, faded सा होता है, although it is also on the left lung. Okay. So now let's move on. Question number 126. Number 126. After this question, let's take a 2 minutes break. Hello, Uttam. How are you? Uttam is with us. Uttam, my Telegram channel is at the rate NEET PG Chetanya. You can join it if you haven't already. Esophagus, it is present in which mediastinum? Esophagus, it is present in the posterior mediastinum, right? Esophagus is present in the posterior mediastinum. You know that esophagus, it is a very posterior structure. It is even posterior to the trachea, and esophagus is present in the posterior mediastinum behind the fibrous pericardium of the heart. Okay, let's take a 2 minute break. Six 16. Let's take it till 6:18. Some water. Meanwhile, if you have any doubts, you can ask those. If you have any doubts, you can ask those. Sub has sent some water for. Thank you. Meanwhile, you guys can hit the like button on this video. Anji Utsab. सर BCQ बुक्स की रेफरेंस दें. Surface anatomy important. The surface anatomy, I will say, if you are preparing for your prof examinations, surface anatomy is important only in case of two things. Okay. Surface anatomy, I will say, it's important when it comes to some surgical landmarks. ठीक है, surgical landmarks के लिए important होती है थोड़ी बहुत. So basic surface anatomy is a little important. For example, your surface anatomy for your aortic valves. That's important. Okay. But it is only mainly important for your vivas rather than your theory. It's not very important for your theory exams. It's important mainly for your vivas and for some PG questions where you are asked regarding some landmark. इसके reference दे दें. So MCQs you will get ample practice from my Unacademy lectures. ठीक है. You can simply join my Telegram channel. I keep putting ample number of MCQs. बाकी बहुत सारे Telegram channels हैं जहाँ पे you will find a decent practice of MCQs. तो basically वहां से ले लो यार. Otherwise I am not sure that I should be recommending any specific book. Unacademy का जो क्वेश्चन बैंक है दैट्स प्रीटी रोबस्ट. ठीक है. Unacademy पे आई विल होस्ट लाइव क्विजेस फॉर यू एंड वहां से बहुत एमसीक्यूज की प्रैक्टिस मिलेगी. ठीक है. Unacademy लाइव क्विजेस. Unacademy के पास अनलिमिटेड क्वेश्चन बैंक है हर चीज का. ठीक है. क्वेश्चन नंबर 127. लेट्स रिज्यूम. एंटीरियर डायफ्रामेटिक हर्निया. इतनी बार कर चुके हैं हम ये पिछले. वी हैव डन इट एवरी डे. वी हैव डन इट इन एमसीक्यू part 1 for thorax, we have done it in MCQ part 2 for thorax, and now we are doing it in MCQ part 3 for thorax. कोई एक तो होता है जो डिसलाइक करके जाता है यार वीडियो को. कोई नहीं, क्या कर सकते हैं. Okay, only Sangeet has answered. I'm waiting for others to answer. Utsav has answered as okay. Sangeet has answered as option A, esophageal opening. Then Utsav has answered as C, foramen of Morgagni. Only one is correct. I'm waiting for one more answer to decide. तो आंसर गिवन बाय मोस्ट पीपल इज सी। ठीक है, ए और सी दोनों में कंफ्यूजन हो रहा है लोगों को। एंटीरियर डायफ्रागमेटिक हर्निया इट इज थ्रू द फोरामेन ऑफ मोरगैगनी। ओके, देयर आर टू, वन इज थ्रू फोरामेन ऑफ बोशेडेलिक, so that's one, and the other is through foramen of Morgagni. This is called as retrosternal hernia. This is called as retrosternal hernia, occurs behind the xiphoid process. Okay, Morgagni is anterior and Boschedelic is posterior. That's absolutely true. Okay, इसकी image भी थी अपने पास. I don't think I put it here. देखो, so yeah, this is the image that I want to show you. This is where you have the foramen of Boschedelic, right? And this is where you have the foramen of hernia, and they're diagonally opposite most common. ये posterior left side पे ज़्यादा common होता है, ये anterior right side पे ज़्यादा common होता है. Okay, so look, have a look here. This is the foramen of Boschedelic, and this is the foramen of Morgagni. Okay, foramen of Morgagni more common on anterior side and right side. This is Boschedelic is posterior and left. Boschedelic is on posterior and left. Very good question. Posterior to sternum, what do you have? Posterior to sternum, what do you have? This is your sternum. Somebody is saying right atrium, somebody is saying right ventricle. Sangeet is saying this, Raj Pawan is saying this, Prashant is. Yeah. So option C is right atrium, option D is right ventricle. Let me show you an image and then you tell me. Posterior to sternum, what do you find? Sangeet MK, it's very important for you to understand that how the heart is located beneath the sternum and the ribs. Okay. So this is the boundary of your heart, right? This is the boundary of your here. So obviously heart is displaced towards the left side. So beneath the sternum, you will not have something of the left side, left ventricle or left atrium. तो पक्का नहीं होंगे. That is something that you can definitely say. Now it comes down to between right ventricle, left ventricle, right ventricle and right atrium, right? So if I draw a boundary, the right atrium is relatively very small. So mainly the structure that is present behind the sternum, that is the right ventricle. That is going to be your right ventricle. That is going to be your right ventricle. That's the structure that is present behind the sternum. That's the structure that is going to be present behind the sternum, right? I come back here. Posterior to sternum, you will have right ventricle. You will have right ventricle. Okay? 128. The answer is D. Question number 129. Very easy. This is not even a class. Which class question is this? I would say that this is a class 11 question. तब ज्यादा पढ़ा तो क्लास 9 क्वेश्चन भी है यार ये. नीट पीजी में कहाँ आ गया ये, है ना? कोई गलत मत दे देना यार, इसका जवाब बहुत बेइज्जती होगी। का आंसर गलत मत देना, सीरियसली स्पीकिंग। हाँ मैं भी बेइज्जती करूंगा। ठीक है, so there are three kinds of ribs. There are, I'm sure nobody will give the wrong answer. True rib, false rib और floating rib। तीन तरीके की रिब्स होती है। सीआरटी में लिखा था यार, ये तो 11th की मेरे को याद है, ये लिखा था। ठीक है, ट्रू रिब्स आर 1 to 7, फॉल्स रिब इज 8 9 10 एंड फ्लोटिंग रिब इज 11 12। तो आंसर कौन सा होगा? 10th रिब, फॉल्स रिब। आगे चलो, क्वेश्चन नंबर 130 पे आओ। लेट्स कम टू क्वेश्चन नंबर 130। लेट मी से दैट दिस इज मल्टी आंसर करेक्ट। ठीक है, एक बार को मान लो कि ये, चलो मल्टी आंसर करेक्ट बोलूंगा तो तुम कंफ्यूज हो गए। छोड़ो, 130 में आंसर बताओ। हाँ 129, एवरीवन इज सेइंग बी, वेरी गुड वेरी गुड। 129 के लिए तो वेरी गुड भी नहीं बोलना चाहिए, बहुत इजी क्वेश्चन। 130 का बताओ। So answer is going to be Scalenus medius, right? There is only one correct answer, that is Scalenus medius. So see, important point that I was trying to emphasize was that I was trying to confuse you by thinking, by making you think that Scalenus posterior also attaches, but you are smart enough to know that it does not. Nobody wrote A in the answers. There are these three muscles. So this does not attach to the first rib, it attaches to the second rib. It attaches to the second rib, whereas these two muscles, they do attach to the first rib. They attach to your first rib. That is for question number 130. ठीक है, scalene medius और middle scalene, or you can also write it as middle scalene muscle. 130th, the answer is option C. Okay, sorry for confusing you. Let's go ahead. Question number 131. Okay, guys, this is not enough for you to tell me. ठीक है? You also have to tell me the further category of the joint. ठीक है? चलो तुम पहले 131 का आंसर दो एक बार. Zubair is saying that the answer is B. Raj Pawan is saying that the answer is B. Sangeet has also said the answer is B. तो तीन लोगों ने बोल दिया तो आंसर मैं B टिक कर दूंगा. Synovial joint is the correct answer. Now tell me what type of synovial joint? What type of synovial joint? Nishi has also said the answer is B. Very good, very good. Shabash, very good. Right. Raj Pawan has answered correctly. It is a plain synovial joint. Plain synovial joint. Very good. That was the answer I was doing. Very good. Question number 132. Okay. Some of you are saying C and some of you are saying B. Have to show. Right. So AV node is located in the Koch's triangle, right? So you can make out here that the AV node, it is part of the triangle of Koch. It is part of the triangle of. That's going to be the correct answer. Yeah. So this is one image where you can see it, but it's too small. Basically, where can you make it? Yeah, समझ गए तुम लोग समझदार लोग हो. The interatrial septum. It's not in the intervertebral septum. The interatrial septum. Opening of SVC के पास होता है SA node. Yeah, that's about 132. 133. Oh, happened. लाइट बंद हो गई. मेरा वाईफाई बंद नहीं हुआ. Wait, let me switch on another. सॉरी गाइस, अजीब अजीब चीजें हो जाती हैं क्लास लेते लेते। बस यही फर्क है क्लासरूम और रूम पे पढ़ाने का। सॉरी। सॉरी 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 सॉरी। बल्ब भी जला देता हूँ। आई थिंक ठीक दिख रहा है। आर यू एबल टू सी मी गाइस? वेट, लेट मी जस्ट सी इन द वीडियो। ठीक ही हो गया अब आई गेस, है ना? Segments of the upper lobe of the right lung. Segments of the upper lobe of the right lung. So for that, I'll take you to another image. Let's take you here. Segments of the upper lobe of the right lung, है ना? See, this is the right lung. This is the upper or the superior lobe, and segments are apical, anterior, and posterior. Segments are going to be apical, anterior, posterior. ये 3D orientation में है, apical, anterior, posterior. ठीक है, एक बार segments revise करते हैं राइट लंग के, है ना? फिर लेफ्ट के भी कर लेंगे, चलो। Bronchopulmonary segments, they are very important. Right lung, left lung. Let's divide it. Right में you will divide it into three, obviously. Superior, ठीक है? Then middle and inferior. Superior में you will say apical, anterior and posterior. Apical, देखो ये एक ऊपर वाला है, एक आगे वाला है, एक पीछे वाला है. Apical, anterior, posterior. ठीक है? Then उसके बाद what about middle lobe? You will have medial, lateral, and you will have superior. Medial, lateral, and you will have superior. Superior lobe, you will have anterior basal and lateral basal. This side you will have apical, posterior, anterior, superior, inferior. All of these will be in the superior lobe. In the inferior lobe, you will have superior, anterior medial basal, and you will have lateral basal. ठीक है? ये एक स्पेसिफिक व्यू से हमने लोब्स देख के बता दिए। अभी हम इनकी बात कर रहे हैं। Now let's go back to our question. Question asks which are the segments of the upper lobe of the right lung. Now you should be able to tell me which are the segments. We just studied those segments. Which are those segments of the upper lobe of the right lung? You all have said the right answer. That is apical, anterior, posterior. Apical, anterior, posterior. यही पढ़े थे ना अभी जब हमने डायग्राम खोला था दूसरा वाला. We saw that this was the right lobe. ठीक है, उसमें ये सुपीरियर बन रहा था, उसमें ये थोड़ा ऊपर का पार्ट एपिकल था, इधर एक एंटीरियर था और एक पोस्टीरियर था. ठीक है, ये थे एपिकल, एंटीरियर, पोस्टीरियर. ओके. क्वेश्चन नंबर 134. Thoracic duct, it does not drain the thoracic duct does not drain the right upper part of the body. Thoracic duct does not drain the right upper part of the body. Yeah, I will show you this diagram also. There diagrams, I don't know, I had copied them here, but somehow they all are not showing up. What have happened? So I had shown you yesterday also that the thoracic duct may the left jugular, left subclavian, left bronchomediastinal trunks. All of these they drain into the thoracic duct. But on the right aspect, right jugular trunk, right subclavian trunk, right bronchomediastinal trunk, all of these they do not drain into the thoracic duct. Instead, they drain directly into the right brachiocephalic vein. They drain directly into the right brachiocephalic vein. So the thoracic duct it does not drain the right upper side of the body. Yesterday I had drawn an image also for you something like this, है ना? So it showed you that this much part it is drained by the right lymphatic duct, rest of the body is drained by the thoracic duct. Rest of the body is drained by left thoracic duct. Okay. यार पुनीत यार मेरे को लगता है किसी ने ना एमसीबी ट्रिप करी है एक बार एमसीबी कर देगा है ना एक्चुअली कुछ तेरे कमरे में लाइट आ रही है नहीं यार ये मेरे को लगता है एमसीबी एक बार देखेगा अपने वाली एमसीबी में कोई ऑफ भाई किसी ने मजाक में एमसीबी ऑफ कर दी क्या करते रहते हैं ये लोग हॉस्टल में क्लास ले लेके Question number 135. Not true about the right bronchus. Not true about the right bronchus. The answer is it is going to be option C. Option C, more horizontal. That is not true about the right bronchus. It is not more horizontal, it is steeper. I just told you that it should be more probable that a particle should go into the right bronchus. So it has to be shorter, it has to be wider, it has to be steeper. Angle भी बताया था tracheobronchial angle 25 to 32 degree. ठीक है Vineet Kumar Yadav, answer is C, not A. Right bronchus is actually shorter, it is actually wider, it is also steeper. Okay, 136. About cardiac muscle. True about cardiac muscle. That's true. It has a large central nucleus. So remember the cardiac muscle, it is uninucleate. It is uninucleate, mostly uninucleate, sometimes might be binucleate. It is not spindle shaped. Spindle shaped is only your involuntary muscle, right? Unstriated muscle. It has gap junctions. It has ample number of gap junctions. That is why cardiac muscle forms a syncytium. It is not arranged in the form of sheets. Okay, this is also false. So that is why 136 the answer is going to be option B. 136 the answer is going to be option B. Question number 137. Tell me about this. Right superior intercostal vein has been. Okay. Tell me about both the right and the left. You also tell me about the left one also. ठीक है लेफ्ट के बारे में भी बताओ. 137. Zubair Ahmad, you are answering A. Vineet Kumar Yadav is also answering A. You guys just read the question carefully. यार right के लिए पूछा है, left के लिए नहीं पूछा. Very carefully read it. ठीक है. Sometimes you will think that question तो exception से ही आता है. Exception से नहीं आ रहा है question यहाँ पे. ठीक है. The right superior intercostal vein, where does it drain? आना ही पड़ेगा लगता है ये. बहुत क्वेश्चन थे इसके ऊपर फर्स्ट वाले एमसीक्यू राउंड में. यार have a look here. The on the right side you can see that everything it goes smoothly. It goes into the azygous vein. It is going into perfectly rightly into the azygous vein. On the left side there is an abnormality. On the left side it is going into the left brachiocephalic vein. Okay. So on the right side, the right superior intercostal, it goes into the azygous, and the left superior intercostal, it goes correctly and it goes into the left brachiocephalic vein. Okay, so you will make a mistake. You will think that the question it is always being asked from the exception, but the examiner is asking you something that is from the normal side, something that is from the expected manner, right? So the answer here is going to be the azygous vein. Please don't get confused. Okay. Okay. Welcome, Progresh Limbu. Question number 138. Left bronchus is. What is left bronchus? Right. So I've already shown you that how to right bronchus and left bronchus, how to remember that right bronchus it is more probable for something to go inside it. So if it is more probable तो क्या होगा? Short होगा obviously, तभी easily जा पाएगा इसके अंदर. दूसरा क्या होगा? Wider होगा. दूसरा क्या होगा? Steeper होगा. So 138, what will be the answer? The answer will be option A, like all of you have said. Zubair, Rajapna, sorry, Rajpavan, Sangeet, Vineet, Mishti. Answer is longer and narrow. Absolutely correct, you guys. Question number 139. Not true about the visceral pleura. Which of the following is not true about the visceral pleura? 139, guys. Tell me your answers quickly. I'll show you a table of differences also then. Okay. So Raj Pavan is saying this, Zubair is saying this, and Vineet is saying this. वाह वाह, सारे आंसर आ गए भाई. You're asked what is false. What is false? So remember that visceral pleura is pain insensitive, parietal pleura is pain sensitive. So this is true. This is true. Raj Pavan is wrong. Okay. Then next, let's talk about what Vineet is saying. Vineet is saying it is supplied by phrenic nerves. Yes, this is false. It is supplied by ANS, not by phrenic nerves. So the answer is option B. It has three borders. That is true. Does have three borders. And it develops from the splanchnopleural mesoderm. Okay, there is somatopleuric and there is splanchnopleuric. So parietal develops from somato and this develops from splanchno. ठीक है, इसका भी टेबल दिखा देता हूँ. Where is the new folder? Have a look, okay? Have a look here. There's the parietal pleura, there's the visceral pleura. Okay? Parietal pleura develops from the somatopleuric layer. Visceral pleura develops from the splanchnopleuric layer. Parietal pleura develops from somatic nerves. Visceral pleura develops from the autonomic nerves. Parietal pleura is pain sensitive. Visceral pleura is pain insensitive. Okay? Here intercostal nerves and phrenic nerves are going to supply. Here the supply is going to be autonomic, sympathetic and parasympathetic. And these nerves they accompany the bronchial vessels. So those are the points of difference between parietal pleura and visceral pleura, and I have simply summarized them for you so that it's very easy for you to refer to any of them. Let me close this tab. Question number 40. Blood supply of the ventral two-third of the interventricular septum of the heart. Ventral two-third of the interventricular septum. Right. So blood supply is going to be left coronary artery. That's right. All of you are right. So if you divide the interventricular septum, anterior 2/3, posterior 1/3. ठीक है अभी. So this was your heart. This was your heart. I cut it from here. I cut it from here. ठीक है बीच में septum जा रहा था. So and now I'm looking at it from above. So there is a posterior 1/3 of the septum. There is anterior 2/3 of the septum. Anterior 2/3 will be supplied by left coronary artery. Posterior 1/3 will be supplied by right coronary artery. Okay, that's your answer. Left coronary artery. That's your answer. Left coronary artery. Okay. Question number 141. Very easy. Again, class 11th question. Costal cartilages of these ribs do not reach the sternum. Do not reach the sternum. Class 11th question. Please don't make me solve this. Answer in 5 seconds. Within 5 seconds, I should have your answer for 141. क्विकेस्ट आंसर दे दो इसका भाई. अरे यार 141 गलत कर दिया जुबैर. जुबैर ने 141 क्यों गलत कर दिया? ओहो. ट्रू फॉल्स फ्लोटिंग का कॉन्सेप्ट लगाओ यार. ओ माय गॉड, यू गाइस क्या कर रहे हो? गाइस बेस्ट ऑप्शन चूज करो, बेस्ट ऑप्शन. इसका सब क्यों गलत कर रहे हैं? जुबैर, मिष्टी, राजपावन, ऑल ऑफ यू आर मेकिंग दिस रॉन्ग. 11th क्लास का क्वेश्चन है यार. हाँ, संगीत has given the right answer. Answer is 11th and 12th ribs. They are floating ribs. 11th and 12th. The false ribs, that is the 8th, 9th, 10th, they are connected to the sternum through the 7th costal cartilage. They are connected to sternum via 7th costal cartilage. So when you have the option for 7th costal cartilage, when you have the option to go for 7th costal, 11th and 12th ribs, why will you go for 8th, 9th, 10th ribs? I don't understand. Okay, ये गलत मत करो. Okay, 11th and 12th, no doubt, no doubt. Answer is A, 141. ठीक है, मैं ज़्यादा डिस्कस नहीं कर रहा. Very basic question. It is not visible properly. That's why I read it out. Do not reach the sternum. Do not reach the sternum. Okay, sorry. Question number 142. Structure passing through esophageal opening of diaphragm. Structure passing through esophageal opening of diaphragm. Right, gastric nerves. Absolutely true. So what all passes through the esophageal opening? Esophagus and vagus, the anterior and posterior vagus, which are being referred here as the gastric nerves, right? Very good. Most of you are able to answer. Not B. Vinisha. Vinisha. Okay, यार ये तो गलत आंसर दे रहे हो तुम लोग अब. पहले मिष्टी ने सही आंसर दे दिया, संगीत ने सही आंसर दे दिया, then people started answering wrong. Right phrenic nerve. Which opening does it pass through? It passes through the सबने अलग अलग आंसर दे दिया. शाबाश. Azygous vein passes through the aortic opening, right? Thoracic duct passes through the aortic opening. Aorta passes through the aortic opening. Right phrenic nerve, it passes also through the vena cava opening, right? It passes through the caval opening. But Esophageal opening of diaphragm, you have the gastric nerve spasm. You have the gastric nerve. 143 muscle of expiration. No opening किस लिए लिखा है? संगीत MK, for what have you written no opening? See, I think you got confused. Right phrenic nerve, it passes through the vena cava opening. And the left phrenic nerve, it passes through the left crus of the diaphragm. It does not pass through any opening, it passes through the left crus of the pierces the left crus. Okay. 143, you are saying muscle of expiration. Muscle of expiration, you all have answered correctly. Again, 11th class question. Answer is going to be internal intercostal. Contraction of internal intercostal helps in forceful expiration. Okay. External intercostal is used for inspiration. Very easy question. Let's move on. Question number 144. All of the following are contents of the middle mediastinum except contents of middle mediastinum. Contents of middle mediastinum. Yes, the left phrenic nerve pierces the dome of the diaphragm, not the right phrenic nerve. Right phrenic nerve, it passes through the vena cava opening. Okay, that question, the options had right phrenic nerve. So this passes through a vena cava opening. Okay, left left phrenic nerve is the one that you are talking about that pierces the diaphragm. Okay, लेफ्ट और राइट में कंफ्यूज मत हो. राइट से जाती है सुपीरियर वेना cava, राइट से जाती है राइट फ्रेनिक नर्व. तो राइट फ्रेनिक नर्व और राइट सुपीरियर वेना cava, they will together go through the vena cava opening. Okay, there is no confusion about that. There should be no confusion about that. Very simple. 144. 144 का भी सही जवाब दे रहे हो सब लोग. वेरी गुड. Right, Rajbhava is right. Rajbhavan is right. Afreen is right. Zubair, all of you are right. The answer is arch of aorta because it is present in the superior mediastinum. Because it is present in the superior mediastinum. ठीक है. Question number 145. Last question for today. I want everyone to get this correct. Options are also very easy. Thoracic duct, it crosses from the right side to the left side at which vertebral level? Last question of today. After this last question, I have some things for you to do. ठीक है, क्या क्या करना है आपने सुन लो. पहले 145 आंसर कर लो. क्या है आंसर बताओ. उसके बाद थिंग्स टू डू. फर्स्ट, इस वीडियो को लाइक कर दो यार. अपने कॉलेज के दोस्तों में शेयर भी कर सकते हो. इफ यू वांट टू शेयर सम पर्टिकुलर वीडियो दैट यू रियली लाइक, then please join my telegram channel, that is @ NEET PG Chetanya. @NEET PG Chetanya. Third, if you can, please purchase a plus subscription because tomorrow I am starting a plus course. Enroll for my plus course if you have a plus subscription. Unacademy plus subscription. कल से स्टार्ट हो रहा है 22 नवंबर. ओके. Right, so 145, you all have answered B, that is the T5 level or the second grip. That's exactly correct. So remember our mnemonic MAD RAT BP for sternal angle. MAD RAT BP. है ना? So इसमें D was the thoracic duct, and that the question is thoracic duct crosses from the right side to the left side at which vertebral level? So sternal angle is at the level of T4, T5. So answer is going to be option B, T5. No doubt about it. Thank you so much for attending the quiz. Please follow these steps. I will tell you again about my plus course. First, thank you so much for attending the quiz. Do hit the like button. Do subscribe to the channel Let's Crack NEET PG. ठीक है, Let's Crack NEET PG है चैनल का नाम जिस पे आप देख रहे हो. And you can hit the bell icon here itself to get notifications every time I'm live here on the channel. This probably might be the last YouTube video. Then after this, I'll make two small YouTube videos for which will be recorded sessions where I will give you some special points for your physiology prof examination. ठीक है, I will do that for your physiology prof because somebody said कि यार anatomy बहुत हो गई, अब थोड़ा बहुत physiology, embryo, history ये भी बता दो थोड़ा थोड़ा, है ना. तो I'll make two short videos for your two prof answers for your physiology. And then do drop some comment in the YouTube comment section for any video that you can. Join my Telegram channel at the rate NEET PG Chetanya. And if you take a plus subscription, this is the only referral code that you have to use, Chetanya 10, for any plus subscription, whether it is you or your family member who is taking. Thank you, Raj Pavan. Thank you, Afreen. Thank you, Zubair. You people who attend my quizzes, you are the people who make these quizzes very interactive and very interesting for me also. Okay? Do use my referral code, that is Chetanya 10. Okay? You get a 10% off. You can also apply credits to get another 10% off. I will personally tell you how to do so. Please contact me. I will be willing to help you out with anything you want. Okay? And my Instagram ID is @chaitanya.blue. You can text me there also. ठीक है, एक दो दिन लग जाता है यार कभी कभी रिप्लाई करने में, but I will definitely try to reply, especially if you write that you want a plus subscription. ठीक है. So see you soon with more MCQ marathons. ठीक है. Meanwhile, you can watch my previous session on the channel. I'll tell you again about my plus course. Okay, so it's a plus course on gastrointestinal physiology. So it's on Unacademy Plus. So all the top educators, they are making plus courses on Unacademy, which are paid courses. So this is gastrointestinal physiology. So there's one subscription which gives you access to unlimited number of courses. Okay, that one subscription, that one single subscription gives you access to an unlimited number of courses. Okay, so this is for your plus subscription. Esophagus, stomach, large intestine, duodenum, small intestine, everything. This is just the basic, right? We will be covering so much. See, first part introduction करेंगे, layers करेंगे, which is important for your histo also, enteric nervous system and regulation of food intake. This is a little bit of neuro part. ठीक है. Part 2 we will cover basic electric rhythm, right? Which is very important concept. काफी लोगों को समझ नहीं आता है. Part 3 will focus on GIT movements and the motility part, where you talk about peristalsis, segmentation, migrating motor complex and everything. Part 4 focus on gastrointestinal secretions. Part 5 is going to be hormonal physiology, secretin, CCK, everything. Yes, ठीक है. इस secretions वाले part में we'll discuss saliva, bile, etc. and what are the factors regulating these secretions. Digestion and absorption करेंगे, which is very basic, which you might have probably studied previously also. We'll consider some aspects of that. Then I will also take your doubts. We'll try to do MCQs with each class, and we'll also focus on some additional concepts, right? Some miscellaneous concepts. Okay. So that was for today's class. Thank you so much. My name is Chetanya Mittal. I'm a MBBS student at AIMS New Delhi. Okay. And with that, we are done with Thorax MCQ Marathon. Thorax की MCQ Marathon हो गई खत्म. तो हमने किस किस की कर ली है? अपर लिम्ब की कर ली है, लोअर लिम्ब की कर ली है, हेड एंड नेक की कर ली है, थॉरेक्स की कर ली है. I think only abdomen MCQ marathon is left. Probably we will take that up in January, right? And I think with that we'll be finished with gross anatomy at least. थोड़ा general anatomy वाला part रह रहा है और MCQs, ठीक है? Okay, let's see how we proceed. Thank you so much. I'll be ending the stream now. If you have any doubts, you can let me know.